Okay, so I've been having a little problem with my left heel for a little while, and so Dr. Cora Atkinson is going to check my the motion out on my foot bones and ankles and all of that, and then she's going to adjust it if it needs to be, and then we will also do a video with me getting some K-laser. So here we go. So, do you want me to lay down?
Yes.
Okay. So, get this right here. Okay, so it's going to be from my perspective, so it might be a little bit funny. Okay, so you just go ahead. Your face is not even on there. So she's checking the range of motion, dorsiflexion is what she's looking at there, I assume.
You said it's the left foot that's Do you feel how that left one's kind of restricted coming back?
A little bit more, yeah.
There we go.
Oh yeah, I felt it.
Just move that talus bone back in better alignment.
Yeah, it's real tender along the outer edges. That one's not.
The other one right now.
Actually, all the way around the heel, around the back. Yeah, right there.
Tender right there.
So she's going to use the activator.
Right there too. And just come right to the other side.
All right, it already feels a little bit better actually. Right at all the motion that you were doing, the testing and everything looks better. Okay, great. Right now we're going to do the K-laser, and you can see I have my glasses on. Me and Dr. Cora and I are around each other all the time. That's why we're not wearing masks, okay? So I don't want anybody to get on to us for not wearing masks, all right? So next thing you'll see is her doing the laser on my left foot. All right, here we go. So the whole idea of the laser is to basically paint the tissue with this, what it is it's light. And the power of the laser pushes that light into the tissue, and it does several things. First of all, one of the wavelengths works just on the skin. And it works with the melanin, and it also helps to kill bacteria and that type of thing. So it's really, really good for scars and things like that, helping them to heal quicker, as well as not get infected. The second one, the second wavelength, what it does is it affects the, what's the second thing? It affects the hemoglobin. So the hemoglobin, it drops oxygen off to the cell, and what the lasered tissue does is, as the blood supply, as the hemoglobin gets lasered, the light causes it to drop oxygen off to the cell more efficiently. So it's kind of haphazard otherwise, but this causes it to be more efficient. The third wavelength, what it does is it works on the mitochondria, and specifically the enzyme that causes the reaction that creates ATP, which is the energy of the cell. The fourth wavelength in our class 4 laser, what it does is it affects the water. So it affects the water in the blood, and it increases the circulation to the area that's getting lased. So it's real effective in dealing with these soft tissue type of injuries, connective tissue type of injuries, even things like whiplash. There's been a lot of studies on even concussion patients doing better when you do the laser to the brain tissue and to the nerve tissue. So there is very few. There's no side effects. I've never had a side effect. The whole idea with a class 4 laser is to keep the laser light moving, because if you keep it over one spot for a long period of time, it can cause some burning as well. But the whole idea is keep it moving. So I'm going to show you this little instrument in here. I'll take that. Thank you, Dr. Cora. Appreciate it. So this is the laser, and it's pretty neat because it's very much like, almost like Star Trek, really. And so what we do is, when we're doing this laser therapy, we can go up here to patients, brings up my name. Let me say, there we go. Brings up my name, and we can repeat the most recent treatment. We can treat a new condition, we can delete the patient, or we can view the history. So I'm going to say repeat the most recent treatment. And that loads a program into the laser so that we can have the correct parameters. And of course, we can change all of this at the same time. When we press this laser, we can choose any of these applications. And so with the plantar fasciitis, we use that one right there. And then the laser is armed, and then you can see the treatment time is quite short, really. It's only 2 minutes and 34 seconds for a foot type of a problem, and it's really great. So this class 4 laser, we can do very low time period treatments. So it's really great, and especially if you are certified and you're trained well, so that you can cut down on any adverse types of reactions that somebody might have. So this is Dr. Dennis Fiorini, Fiorini Chiropractic Center. If you have someone or know of someone that's having some problems with plantar fasciitis, carpal tunnel syndrome, tennis elbow, those types of things, give us a call and we'll try and help them. The laser can help them. Have a great day.